A 19-year-old female presents to the GP with her mother. She is reporting a growing breast lump that is causing her distress. You offer to examine her and asks if she would like a chaperone. She says that she does not want a stranger there, so would rather have her mum as a chaperone. What do you do? Explain that family members cannot be used for chaperones and re-offer the patient someone at the practice to chaperone. Accept the mother as a chaperone, but ensure you have documented this in notes. Explain that family members cannot be chaperones and ask her to rebook for 2 weeks' time. Explain that family members cannot be chaperones and document this in her notes. Continue the examination on your own. Explain that it isn't her choice who the chaperone is. Continue the examination on your own. You should not do the examination on your own. You need a chaperone. However, the chaperone has to be someone who is unbiased. So yes, right, GMC stuff. Right. You can sort of use rational reasoning to find the answer. A 36-year-old with a long-standing history of schizophrenia presents to emergency department in status epilepticus. Epilepsy means having seizure for more than 5 minutes. Once he is treated, he tells the doctor he has been having a lot of seizures recently. Which of the following medications is most likely to be causing the seizures? So, he has a history of schizophrenia, so he might be taking neuroleptics. However, neuroleptics inhibit dopamine. Not sure it can cause seizures. Diazepam is benzodiazepine. Clozapine is a neuroleptic. It's a second-generation antipsychotic. I don't know that it can cause seizure. I don't think so. Diazepam is a benzodiazepine. It suppresses the brain activity, so shouldn't cause seizure unless it's withdrawal from diazepam. Fluoxetine is a SSRI, selective serotonin uptake inhibitor. Using it increases levels of serotonin in your brain, which may increase the activities in your brain, may induce seizures. Olanzapine is another neuroleptic. It decreases dopamine. I don't know that it can cause seizures. Haloperidol is a first-generation antipsychotic. It decreases dopamine as well. However, if this person is having schizophrenia, I don't know why he's taking fluoxetine. No, the answer is clozapine. So clozapine does cause seizures. Clozapine reduces seizure threshold, making seizures more likely. I see. Clozapine is an atypical antipsychotic used for treatment-resistant schizophrenia. It has many side effects, one of which is that it reduces the seizure threshold, which is most likely to be causing the seizures described in this question. Olanzapine is another atypical antipsychotic, and haloperidol is a typical antipsychotic, but neither are associated with reduced seizure threshold. Fluoxetine is an SSRI, and diazepam is a benzodiazepine. It's actually used to treat seizures. So clozapine reduces seizure threshold. Something to remember there. Is there any reasoning? What does posology mean? The part of medicine concerned with dosage. Cautions, titration, and a divided dose schedule are necessary to minimize the risk of hypotension, seizure, and sedation. Seizures. Patients with a history of epilepsy should be closely observed during clozapine therapy. Since dose-related convulsions have been reported in such cases, the dose should be reduced, and if necessary, an anticonvulsant treatment should be initiated. Owing to the ability of clozapine to cause sedation and lower the seizure threshold, activities such as driving or operating machinery should be avoided. These symptoms are more likely to occur with rapid dose increases and in patients with pre-existing epilepsy. There's no reasoning behind it, it just does reduce the threshold for seizures.